The misuse of antibiotics is a great problem nowadays. And herein there are two cases. Either you receive a high dose of antibiotics, which could harm your metabolism in the longer run, or you receive a lower dose of antibiotics, which leads to antimicrobial resistance.
Therapeutic drug monitoring is mainly performed using chromatographic methods, which requires high instrumentation costs, complex sample preparations, and most importantly, an extended amount of time is needed for the analysis. There are two significant problems in the current methods. They are expensive to conduct and require typically a day to receive the answer. Our sensor technology enables us to quantify antibiotics as good as gold standard methods in less than 90 minutes in a cost-effective way. We can also process both blood and plasma as well as more accessible bodily fluids such as saliva, urine, and breath on the same microfluidic chip simultaneously. One of the unique features of our technology is that we can track and quantify drug levels even in breath.
We are using an electrochemical microfluidic biosensor which employs a penicillin binding protein as a biorecognition element. These proteins are actually produced with the help of Professor Wilfried Weber from the Excellence Cluster BIOS and SIPS. And this penicillin binding protein could bind any antibiotic with a beta-lactam ring, and this binding will result at the end a current change which we could easily detect.
We have recently conducted an animal study and confirmed our predictive accuracies by comparing our results with gold standard measurements. Now we are ready for the clinical studies and work with patients. After this step, our sensor could be used in practice as a complementary tool.
Our goal is to create a personalized antibiotherapy using our biosensors. And herein it's important not only to measure the drug concentrations, but also measure inflammation biomarkers, which indicates the start and end of a personalized antibiotherapy. Besides, our sensors are used for measuring hormones or nucleic acids and also other substances on site and in a low-cost manner.